Anatomy 32, Chapter 15, the lymphatic system and immunity. Topics, functions, and lymph circulation. So the lymphatic system has three main functions. The first is to drain excess interstitial fluids. These are the fluids found in the tissues of the body. Basically, more fluid leaves the bloodstream through the blood capillaries, then returns to the bloodstream. So fluids will build up in our tissues, and that can be a problem. But fortunately, the lymphatic system has this network of vessels that will take that excess fluid and return it to the bloodstream. Second is to transport dietary lipids. So again, lipids, fatty materials, are hydrophobic and so cannot be transported without aid through the bloodstream. So the lymphatic system has a way to help transport dietary lipids. And so they take the lipids absorbed via the small intestine and eventually get them into the bloodstream. And then three, it carries out many important immune responses, especially for the specific immune response by the lymphocytes. So lymphocytes we've talked about in chapter 12, we'll go into them some more. They carry out the specific immune response. That is when the body is targeting a specific pathogen. So for instance, if you are infected with influenza, with the flu virus, the lymphatic system would then generate a lot of responses to the influenza virus and only the influenza virus. All right, so as I mentioned before, the lymphatic system drains the excess interstitial fluids that build up in our tissues, and it does this through a collection of interconnected tubes or vessels that gather up the excess fluid and return it to the bloodstream. So it all starts with lymphatic capillaries. Lymphatic capillaries are tiny, tiny little vessels that are found intertwined with blood capillaries, and they collect the excess interstitial fluid. And where does that interstitial fluid originally come from? Well, it originally comes from the blood, because all fluids in the body originally come from the blood, for the most part. All right, so the lymphatic capillaries are composed of overlapping cells, and as the pressure from the fluids build up outside of the lymphatic capillaries, it will end up pushing on the walls of the lymphatic capillaries and cause a gap to form between these overlapping cells, and then the fluids can enter the lymphatic capillaries. Once the fluid enters the lymphatic capillaries, it is now called lymph. Also worth noting that there are protein structures that come off of the lymphatic capillaries that helps attach them to the surrounding tissues so that they stay in place even in the presence of these changing fluid pressures. So again, increase in fluid pressures in the tissues leads to opening of gaps that allow the fluids to enter the lymphatic capillaries. The lymphatic capillaries will then fuse together and form lymphatic vessels found all throughout the body. The lymphatic vessels will then fuse to form the larger lymphatic trunks. There are 9 lymphatic trunks associated with various regions of the body, including the right and left lumbar trunks, the intestinal trunk, the right and left bronchiomediastinal trunks, the right and left subclavian trunks, and the right and left jugular trunks. The trunks will then fuse together to form one of the 2 lymphatic ducts, either the right lymphatic duct, which is draining fluids from the upper right quadrant of the body, or the thoracic duct, which is draining fluids from the other 3/4 of the body. So again, right lymphatic duct carrying fluids from the upper right quadrant of the body, and the thoracic duct carrying fluids from the remaining 3/4 of the body. The ducts then connect to the cardiovascular system, connect to the bloodstream, specifically at the junction between the internal jugular vein and the subclavian vein. So again, the right lymphatic duct connects to the junction between the right internal jugular vein and the right subclavian vein. The thoracic duct connects at the junction between the left internal jugular vein and the left subclavian vein, returning the fluid once again to the bloodstream. This is a one-directional flow. The lymphatic circulation actually doesn't go in a circle. It goes in a line, one-way road from the tissue fluids to the bloodstream. So if you wanted to see the whole story, you have blood capillaries filled with plasma, the fluid of the bloodstream. The plasma, then some of it will leave and enter the interstitial spaces. Within the interstitial spaces of our tissues, it is now the interstitial fluids. As the pressure builds up, the interstitial fluids will then enter the lymphatic capillaries. It is now called lymph. The lymphatic capillaries flow into the lymphatic vessels, which flow into the lymphatic trunks, which flow into the lymphatic duct, which then empties into the junction of the internal jugular and subclavian veins. And now it's blood plasma again. On our models, you'll see locations where we have these lumps. These lumps are the lymph nodes, and the lines connecting those lumps are the lymph vessels or lymphatic vessels. The lymph fluid within the lymph vessels operate under low fluid pressure. Pressure is so low that they cannot overcome gravity. So the lymph vessels turn out to be structurally similar to veins in that they possess valves that prevent the fluids from backflowing. So the lymph can only go in one direction. If it tries to go in the reverse, then the valves will close, preventing that. And it is located in places where muscle contractions and breathing in and out will compress these lymph vessels, pushing the lymph further and further toward its end destination, which is connecting back to the cardiovascular system. Again, the two pumps are the skeletal muscle pump, where contractions of skeletal muscles will squeeze the vessels, pushing the lymph fluid forward, and the respiratory pump, where the expansion of the lungs when breathing will squeeze the lymph vessels, both in the thoracic and abdominal cavities, and squeeze the vessels, pushing the lymph again toward the direction of the lymph ducts. Edema. Edema is when there's an abnormal increase in interstitial fluid volume in the fluids around the tissue. So this woman has edema within her left leg. You can clearly see the difference caused by the disorder. Edema can be caused by lots of things, anything basically that blocks lymphatic structures. So something blocking the lymphatic structure, some material in the way. It could also be caused from too much fluid entering the tissue, so much so that the lymphatic system can't keep up. And or it could be from not enough fluid entering the lymph capillaries for some reason. So either there's some sort of blockage that's preventing the continued movement of the lymph toward the ducts, and or something is causing either excess fluid to enter the tissues or less fluid to enter the lymph capillaries. And that is it for this part of Chapter 15.